It's not news that obesity is a problem in this country. Still, the statistics for Texas are alarming every time we hear them. A 2009 study found that 66% of adult Texans were overweight or obese. More than a third of Texas children from elementary through high school age were obese or overweight, putting Texas above the national average. If the current trends continue, 20 million or 75% of Texas adults could be overweight or obese by the year 2040. As a result, the obesity-related health costs to Texans could quadruple from $10.5 billion to as much as $39 billion by 2040. One contributing factor is the fact that average Americans aren't consuming enough fruits and vegetables. A recent federal study found that only 30% of adults and teens eat the recommended daily amounts of fruits, while 27% of adults and only 13% of teens are getting enough vegetables. Research shows that replacing or decreasing high-energy dense foods, like hamburgers and pizza, with low-energy dense foods, like fruits and vegetables, helps maintain a healthy weight. Another issue that contributes to obesity is food insecurity. To really understand this concept, let's take a look at a kitchen in a middle-class home. The family that lives here has a pretty healthy diet. For starters, there's a fruit bowl. Family members can just swing by and grab whatever they want whenever they want. There are carrot sticks, celery, and cheese to snack on in the fridge, as well as milk and juice and the usual bounty of supermarket goods. Same thing in the pantry. Grains, pasta, tuna, you name it. And when the food runs low, these folks go shopping. Now, imagine you live here with a low-income family and you're 8 years old and there's no fruit in the fruit bowl. In fact, there's never any fruit in there. You open the fridge, nothing but ice cubes and a soda today. The pantry. Well, that's hardly used anyway, so you're lucky if there's usually a bag of chips in there. So you're hungry. You're standing in an empty kitchen and you don't know when you'll see food in there again. That's food insecurity. According to the USDA, in recent years, more than 16% of Texas households have struggled to afford food, ranking our state third in the nation in food insecurity and seventh in the number of families experiencing hunger. And many of these folks who experience food insecurity are also overweight or obese. Now, you may be wondering how someone who doesn't always have enough to eat also has a weight problem. Well, nutritionists have studied this. Both problems are prevalent in low-income urban and rural communities. Causes include seeking calorie-dense foods, like a double cheeseburger and fries, instead of nutrient-dense foods, which would include leaner meat as well as fruits and vegetables. Affordability is part of the problem, as well as the perception that healthy food always costs more. Or maybe healthier fare simply isn't accessible because there's no nearby place to buy healthier food. Other causes include binge eating at times when food is available, limited physical activity due to work schedules or high crime areas, and even stress related to financial situations, poor housing, and other factors related to being lower income. Improving access to healthy food is a critical component of an equitable and sustainable food system. Decreased access to healthy foods means people in low-income communities suffer more from diet-related diseases like obesity and diabetes than in higher-income neighborhoods, which have easier access to healthy food, particularly fresh fruits and vegetables. In both children and adults, Black and Hispanic populations are at greater risk than whites for obesity. In the next chapter, we'll examine how a successful community food system can address these issues.